All right, it's Colorectal Cancer Awareness Month, and we're here now with Dr. Michael Blume. He's a gastroenterologist at MedStar. Did I get it right?
You did.
Good Star at Good Samaritan Hospital. Doctor, I know what delayed me from getting it done, but let's talk about some of the common obstacles that delay people from getting the screenings.
Well, sure. I mean, the big issue is that this is not a comfortable topic to talk about. And when you think about it, when you're going out with your friends or your family with dinner, over lunch or dinner, you're not going to be talking about your colon or bowel function at the restaurant. So it's something that really doesn't come up a great deal. And it's also an issue when you're seeing your healthcare provider. So it may be somebody maybe you haven't seen before, but it sometimes can be a little bit embarrassing. The important thing is have that conversation, really talk about this stuff. And that's what we're doing here is so important because you want to get the topic out of the bathroom and get this more out in the open, so to speak.
Yeah, really out in the open.
And to do this, because colon cancer really is one of the more preventable diseases that you can get, or hopefully not get, if you get screened. So if this hasn't been brought up by your doctor or whatever, start the conversation yourself. Be an active participant in your health care and ask questions and find out what you should be doing.
Well, what are some of the misconceptions about that screening, colonoscopy?
Well, the big thing is this doesn't hurt.
Okay.
I mean, people are scared to death, understandably so. And understandably, it's a little inconvenient, but it's not a painful test in this day and age. And it's important to kind of get past that sort of thing because it really, and when you get done with it, it's just not as bad as you think it is.
Is the bowel preparation part still the worst?
Well, there's no such thing as a fun bowel prep. I'm still looking for that after 30 some odd years of doing that, and I still haven't found it. It is a little inconvenient.
Okay.
There are lots of options, and obviously talk with your healthcare provider about what might be right for you, but it's a short-lived thing, and the benefits that you get for getting this done correctly are really tremendous. And the big thing when you're getting bowel prep instructions is if you want to have this exam to be done correctly. So plan in advance, make sure you have what you need, make sure if you have any prescriptions you get them, and allow enough time. You want to make sure you're home at that time. You don't want to be taking your bowel prep at home and then driving during rush hour to get home.
No,
that might be a little interesting.
That could be
so
real bad.
The more you plan ahead, the less scary this will be, and the less of an unpleasant experience this will be.
All right, Dr. Blume, one of our many fine experts standing by next door to take your calls as we talk about colorectal cancer screenings. The number to call if you want to get your questions answered are 410-671-0702. Our experts are standing by waiting to take your calls, but we're going to send it over to Eric right now for a look at the forecast.